Hi, I am Dr. Kavita. Please do watch, share, subscribe to my channel. Today I am telling you about cervical vertigo in detail. Cervical vertigo is also known as cervicogenic dizziness. It is a sensation of spinning or dizziness that originates from issues related to the neck or cervical spine. This condition can manifest as the feeling that either you or your surroundings are moving when they are not. It is typically associated with neck pain, neck injury, or certain neck postures and movements. Causes. What are the causes of cervical vertigo? Cervical vertigo stems from disturbances in the cervical spine or tissues around it, disrupting the body's balance system. Some common causes include degeneration of cervical spine is one of the causes. For example, osteoarthritis or cervical spondylosis. Next, neck trauma is the one of the cause. For example, whiplash injury from car accidents. Next, inflammation or joint issues may be the cause. Herniated or slipped cervical disc may be the cause. Poor neck posture may be the cause. Blocked or injured cervical arteries, for example, disrupted blood flow to the brainstem or the inner ear, may cause symptoms. Abnormal muscle tone or tension may be the cause. So, what are the causes? Degeneration of cervical spine, neck trauma, for example, whiplash injury from car accidents, inflammation or joint issues, herniated or slipped cervical disc, poor neck posture, blocked or injured cervical arteries, abnormal muscle tone or tension. What are the symptoms of cervical vertigo? Symptoms of cervical vertigo can vary in intensity and may last from a few minutes to a few hours, often triggered by certain head or neck movements. Common symptoms include dizziness or spinning sensation, not always classic vertigo, but there may be dizziness or spinning sensation. There may be a loss of balance or coordination. Patients may feel unsteady, floating, or heavy headed. There may be a neck pain or discomfort in the neck, especially with movement. There may be headache. There may be visual disturbances, for example, difficulty focusing, nystagmus, or blurry vision. Patients may have nausea or vomiting or ringing in the ears or ear pain. Patients find difficulty to concentrate sometimes. There may be change in the walking or gait. Symptoms may worsen after sudden head movement, sneezing, or exercise. Again, I repeat the symptoms: dizziness or spinning sensation, loss of balance or coordination, feeling unsteady, floating or heavy headed, neck pain or discomfort, especially with movement, headaches, visual disturbances, nausea or vomiting, ringing in the ears or ear pain, difficulty concentrating, changes in walking or gait. Symptoms may worsen after sudden head movement, sneezing, or exercise. What is the mechanism of cervical vertigo? The neck houses complex muscles, joints, and nerve receptors that provide the brain with information about head position and movement, playing a crucial role in balance and equilibrium. If these signals are disrupted, for example by injury or inflammation or degeneration, the brain may misinterpret information about body position, leading to dizziness or vertigo. Diagnosis. How do we diagnose cervical vertigo? Diagnosing cervical vertigo can be challenging as there is currently no definitive test for the condition. The process involves comprehensive medical history and physical examination, focusing on the neck, neurological function, and eye movements. Ruling out other more common causes of vertigo like inner ear problems, benign paroxysmal vertigo, and vestibular migraine is important. Imaging studies such as MRI or CT scan or angiography, if needed, is necessary. Vestibular testing or provocative maneuvers like Dix-Hallpike test to differentiate from other vertigo types is helpful. Diagnosis is often a diagnosis of exclusion, meaning other possible causes of dizziness must first be ruled out. What is the mode of treatment in cervical vertigo? Treatment involves addressing underlying neck issues and may include physical therapy, focused on improving neck strength, flexibility, and posture. So, what do we do in physical therapy? We focus on improving neck strength, flexibility, and posture. Next, vestibular rehabilitation. We can make the patient to practice exercises to train the balance system and reduce dizziness. That is vestibular rehabilitation. Medications. Medications are helpful in managing pain, inflammation, or associated symptoms. Next, lifestyle modifications. Ergonomic adjustments, posture correction, gentle exercise routines are the lifestyle modifications in treating cervical vertigo. Manual therapies. Chiropractic or osteopathic manipulation under appropriate medical supervision are sometimes helpful in managing cervical vertigo. I don't have experience in this, so I am not going to speak about it. Surgery. Rarely for severe underlying structural issues, surgery is needed, and you can consult a neurosurgeon if you have cervical vertigo with necessity of surgery. Most cases improve with conservative non surgical measures. So, coming to treatment, physical therapy, vestibular rehabilitation, medications, lifestyle modifications, manual therapies, and surgery. When to seek medical advice. It is important to seek evaluation if you have unexplained dizziness, especially following neck trauma or in combination with other symptoms such as severe neck pain, headaches, vision changes, or coordination problems. Cervical vertigo is treatable, and ruling out other serious causes of vertigo is also very much essential. Coming to the summary table of the cervical vertigo, what are the typical triggers? Neck movement can trigger, postural changes can trigger, a trauma can trigger cervical vertigo. What are the core symptoms? Dizziness, unsteadiness, neck pain, sometimes spinning sensation. What are the associated features? Headaches, visual changes, nausea, and gait issues are the associated features. What are the common causes of cervical vertigo? Neck injury can cause, arthritis can cause, a poor posture can cause, and some of the vascular issues can cause cervical vertigo. How do we diagnose cervical vertigo? With the help of clinical evaluation, with exclusion of other causes of vertigo, and sometimes imaging is appropriate in diagnosing cervical vertigo. How do we treat cervical vertigo? Physical therapy, vestibular rehabilitation, pain management, lifestyle changes. Cervical vertigo remains somewhat controversial as its diagnosis is complex and there is ongoing debate within the medical community about its criteria and exact mechanisms. However, current understanding supports a strong link between neck problems and balance or dizziness complaints. Medical students, what do you read about? What is cervical vertigo? What are the typical triggers of cervical vertigo? What are the core symptoms of cervical vertigo? What are the associated features of cervical vertigo? What are the common causes of cervical vertigo? How a traumatic cervical spine leads to cervical vertigo? How do we diagnose cervical vertigo? How do we exclude other causes of vertigo with cervical vertigo? What is the differential diagnosis of cervical vertigo? How do we treat cervical vertigo? What are the surgical procedures involved in dealing with cervical vertigo? When to consult a neurosurgeon if we have cervical vertigo? How does degeneration of cervical spine causes cervical vertigo? How does herniated or slipped cervical discs cause cervical vertigo? How do we treat a poor neck posture in dealing with cervical vertigo? How are blocked or injured cervical arteries cause cervical vertigo? How is neck trauma related to cervical vertigo? All these. Thank you. Please do watch, share, subscribe to my channel. Thank you.